the audio fine now? Is the audio fine now? Okay, that's great. So replaying whatever I said. So happy evening, everyone. A very good evening. I hope and I believe all of you are doing well. And welcome to the today's YouTube live session, which is NF100 episode 72. I think the most ignored series that we have had so far. After a long time, we are having this a session in this series that is NF100. Yes, Neetu, that is what I was going to ask all of you here. What was the topic that we took in NF100 episode 71? What was the last one that we took in episode 71? So episode 71 basically was about glaucoma drugs. Okay, so that was glaucoma drugs. 70 was basically about cerebellum. Right, 70 was about cerebellum. So this is NF100 episode 72, that is about lymphoma. We are going to focus on the points that you should be knowing for your exam, be it for NEET PG, be it for FMGE, be it for ICT, the ones which are the most important points in lymphoma. You know, what are the key words that help you make a diagnosis? Okay? I'm glad, Cheshta, you remember it was glaucoma drugs. All right, before we begin with this session, tell me how many of you find the topic of lymphoma difficult? I think it is one of those topics where we actually feel like singing Sar Jo Tera Chakra, right? Ye topic hi aisa hai ki it's very, very confusing. So I'll try to give you some tricks on how to remember the important points here in this topic. All right. Okay, so let's start with the topic. Our major focus today is going to be on the non-Hodgkin's lymphoma. Hodgkin's lymphoma, maybe we will do alag se in one of the upcoming sessions. Okay, more focus in the today's is non-Hodgkin's lymphoma, which is more confusing. Okay, and yes, I hope all of you are aware of the NEET PG. This is not only NEET PG but also FMGE extra edge batch that I have started, basically, which includes everything, the mnemonics, the MCQs practice we are going to have in the form of KBMDs and the PYQs and related topics. This is a batch which I have started on 12th of September. We have done with session 1 where we discussed some mnemonics, some very important mnemonics in anatomy, including the perineal pouches, one of the difficult topics, and many more topics that we have covered. The next session that we have in this course is basically tomorrow, that is 14th, and we are going to discuss the mnemonics in biochemistry, right? So that is what is going to happen tomorrow at 12 p.m. is when we have the next class. We also have a free live class, special class tomorrow, another session in the series that we have not had since long, KBMD. So tomorrow 9 p.m. We will also have a KBMD. So this is basically a plus course which is available to the subscribers, plus or iconic subscribers. Please make the best of it. Okay, and we have the Unlock 20 offer which is going on. So now you can get 20% off on your subscriptions. And let me tell you that this ends on September 16th. So make sure you have your subscriptions before 16 because you get 20% off rather than 10% using the code Dr. Nikita. Okay, and all the FMG students, are good news for you. Now that the FMG exam dates have been declared, we are starting with a dedicated revision batch, the last mile revision batch, which has always been a super hit, and it's gonna start on September 16th. So make sure you make the best of this 20% off offer also before the batch starts. And this is going to be at just at the cost of 10K. Right, so 10K, your FMG getting cracked. I think it's a good deal and you should make the best of it. Okay. Yes, and QBank 2.0, the new updated QBank is now available on the platform for the subscribers. Please make the best of it. Practice MCQs from 2 platforms, as I always say, rather than re-practicing the MCQs from one particular source. And if you're looking for getting free subscriptions, then you can give this grand test, which is basically on September 18th, the upcoming Sunday at 9 a.m. If you get the top ranks, you can get significant scholarships and discounts in your Plus subscriptions. So September 18 is when we have the grand test. And August 25, we have launched the integrated system-wise batch, which is for a duration of 5 months. Then we will also have in this batch the discussion of PYQs and the IBQs. Okay? All right. So starting with our today's topic, Translocations, हाँ बताने वाले हैं मोहम्मद कादिर. We are gonna tell you the tricks to remember the translocations, because you do get question on translocations in lymphoma, and that can help you rather identify the type of lymphoma also if you know the translocation, right? Okay. Give me a minute. Okay, so this is a one flow chart that I wanted to show all of you. I'm sure that you cannot see anything of this. Molecular biology is Dr. Radiba. As planned, we are going to see molecular biology in the tomorrow's biochemistry mnemonics class. Right, so tomorrow 12 p.m. all the plus subscribers, molecular biology will be simplified for you. Okay. All right, so this is the part of that flow chart that I want each one of you to focus on. Basically, the lymphoid lineage wala. So in the pluripotent stem cell, basically in the lymphoid lineage, what all tumors do we have? Because we are talking about the lymphomas. Okay? So in the lymphoid stem cells, basically we have the T cells and we have the B cells. T for T, that is thymus. The ones that go to the thymus, basically they become the T cells. And important ones that I want you to remember are the T cell tumors. Those are... all right. So in the T cell tumors, basically you have ATLL, the adult T cell leukemia lymphoma. As the term says, it is AT, that is the T cell. And also remember that mycosis fungoides is also, it is a T cell tumor. It's not a B cell. This is an important question. Can someone tell me a few important questions here, as and when I remember the important points, I'll highlight. Please make notes as you study with me. ATLL, what is the etiology? What is the causative agent that is associated with ATLL? Is it HIV? Is it HHV8? Is it HTLV? Is it EBV? What is the causative agent for ATLL? Right, so remember AT T cell is basically a human T cell lymphotropic wala. So it is HTLV, the human T cell. As the term says, it is your T cell lymphotropic. It has affinity for the T cells. So remember ATLL is basically HTLV. Very good. Mycosis fungoides, next question. It's a T cell tumor. Is it CD4 or is it CD8? That means it is helper T cell or it is cytotoxic T cell. What is it? Mycosis fungoides. It is CD4. This is a previously asked question in one of the exams. Remember, this is CD4 positive. That is the helper T cell. Okay, it is the helper T cell ka tumor. Mycosis fungoides. Okay, it is helper T cell basically. Okay, now remember what is Cesari syndrome. Okay, it is highlighted here. Mycosis fungoides basically is the one which is limited to the skin. When it goes to the blood, it becomes Cesari syndrome. Okay, it becomes Cesari syndrome. So can you tell me how do you identify Cesari syndrome? What is the important image? We will keep reinforcing this as we see the images also. Cesari syndrome, what particular cells, what is the nucleus shape that we have? So you can remember this as Cesari is basically like seizures. Okay, seizures kahan se aata hai? Cerebral cortex, cerebrum se. So remember, it has cerebriform nucleus. Okay, it has cerebriform nucleus. So cerebriform related like the brain, and brain mein se aata hai seizures. So remember, Cesari syndrome is your cerebriform. Okay, that's your cerebriform nucleus that you have. ठीक है? Now the next one, bone marrow wale, basically is going to be the B cell. Okay, so if it's a precursor cell, pre-B lymphoblast, it is going to be lymphoblastic leukemia, that is ALL. How do you differentiate your ALL basically from the other B cell lymphoma? This is lymphoblastic, so remember it would be CD20 negative, because CD20 is present in mature B cells. Okay, it is present in mature B cells. So this will be CD20 negative, while your CLL, which is mature B cells, it is CD20 positive. Okay, CD20 positive. Now we have basically the CLL and the SLL. We'll be seeing these as well. Okay, we'll be seeing these as well. Now when the cells arrive at the lymph node, This is when the lymphomas start. Okay, this is when the lymphomas start. So basically we have the Hodgkin's lymphoma, the non-Hodgkin's lymphoma. The most common non-Hodgkin lymphoma is the diffuse large B-cell lymphoma. Okay, that is the diffuse large B-cell lymphoma. So remember that basically in the lymph node biopsy, if you see, we have the germinal center, we have the mental zone, and we have the marginal zone. Okay. So we have germinal zone, germinal center, mental zone, and the marginal zone. All right. So from the mental zone, as the term says, mental cell lymphoma is going to arise. Okay, so mental zone say mental cell lymphoma. What are the points that you need to remember for each of these lymphomas? I'll tell you those as well. Okay, I'll tell you those as well. Hodgkin's lymphoma and these one, the diffuse large B-cell follicular Burkitt's, they come from the germinal center. And so is Hodgkin's lymphoma, which has reached Sternberg cell positive. Marginal zone, we have this marginal zone lymphoma or SLL or CLL. Okay, what is the difference? I'll tell you that as well. And memory B cells is basically hairy cell leukemia. Okay, hairy cell leukemia. So remember, hairy cell leukemia is memory B cells. All of this we will revise. Coming to the most important topic in lymphoma, that is how do you remember the translocations in the lymphoma? Okay, how do you remember the translocations in lymphoma? Now in lymphoma, if you see the common chromosome that is common in the majority of the translocations is chromosome number 14. Okay, chromosome number 14. Why it is chromosome number 14 which is common? The B cells, majority of them the B cell lymphoma, basically the immunoglobulin heavy chain gene, it is located on chromosome 14. That is why it is common in lymphomas. Now the other chromosomes that can be involved with chromosome 14 is either chromosome 8 or we have chromosome 11 or we have chromosome 18. So basically the translocation we have is translocation 8-14, translocation 11-14 and translocation 14-18. Okay, these are the ones common with the chromosome 14, the translocations that we have. And where do we find these translocations? So remember number 8. Okay, when you write number 8, basically it is like B. Okay, so alphabet B is basically like 8. So remember it is Burkitt's lymphoma. This was a question asked in one of the recent NICT exam also. Okay, in Burkitt's lymphoma, what is the gene? Why chromosome number 8? Okay, remember B, Burkitt's, that is like number 8. Because on chromosome 8, we have the gene. What is the gene? It is the MYC gene, MYC gene. Okay, MYC gene. It is the MYC gene. What MYC gene is it? Is it CMYC? Is it NMYC? Or it is LMYC? L is for lung, N is for neuroblastoma. This is the CMYC gene. Okay, that is what is the gene here. Okay, that is what is the gene. So CMYC gene is on chromosome number 8. That is involved in Burkitt's. That is why all the translocation in Burkitt's will involve chromosome number 8. Okay, all of them will involve chromosome number 8. So what are the other translocations in Burkitt's apart from 8-14? The other are basically, remember the even numbers, 2-8, you have 8-14 and you have 8-22. The other chromosome involved is all the even numbers. Remember, you don't have translocation 8-21. Okay, translocation 8-21 nahi hai. 21 is an odd number. So this is one of the previously asked question. Which of the following translocation is not seen in Burkitt's? It is translocation 8-21. Okay, it is translocation 8-21. All of them are the even numbers. Okay, 2, 14, 22. 8-21, can someone tell me where do you find a translocation 8-21? Where do you find a translocation 8-21? Very good. It is present in AML. What AML? M1, M2, M3, M4, M5? Which AML subtype? AML M1, M2, M3, M4. Where do you find this translocation 8-21? It is AML subtype M2. Okay, it is in AML M2. Remember, 2 ka cube is 8. So basically it is AML M2, which is 2 cube, it is 8. Going to the next one, where do you find translocation 11-14 and 14-18? So imagine like 11 year 14 year old के दो siblings हैं. Like these are the siblings that you have, 11 year old and 14 year old. Almost of the same age, 11 and 14. When you have siblings who are almost of the same age, the age difference is not much. We know that they keep fighting. I'm sure all of us who have had siblings almost of the same age, 2 years, 3 years, elder or younger, we have had a lot of fights during our childhood, and maybe even now we might have them. And that basically made our parents go mental, right? So when you have the siblings almost of the same age, the parents go mental, right? So remember, this is seen, 11, 14 is seen in mantle cell lymphoma. Okay, mantle cell lymphoma. Another mnemonic that I want you to remember here is mantle cell lymphoma is a tumor of which B cells? First of all, it is B cell, it is not T cell. Okay. Is it the memory B cell? Is it the germinal center? Is it the naive B cell? Post-germinal center? What is it in the mantle cell? So remember, which parents become mental? If they are new parents, right? Experienced parents are used to these fights, so they will not go mental. It is the new parents which will go mad. So basically, it is the new B cells, that is the naive B cells. Okay, the naive B cells. These are not the mature or the memory B cells. These are the naive B cells because basically in the mental zone. Where is the mental zone present? If this is the germinal center, surrounding that we have the mental zone. And this mental zone contains the B cells which are the naive B cells. Basically, they are unchallenged B cells yet. They are not exposed to antigen yet. Okay, so remember, these are naive B cells. Another point in mantle cell lymphoma, mantle ends in E. So remember, it is CD5 positive. It is CD23 negative. Okay, it is CD5 positive, CD23 negative. So remember that mantle cell lymphoma E is the fifth alphabet, number 5, CD5 positive, CD23 negative. Versus, can you tell me which is both positive? CD5 positive and CD23 positive, both positive is which one? So remember, both positive, CD5 and CD23, both positive, matlab combined positive, right? It is combined positive. So remember, C for CLL. Okay, it is CLL which is both positive. Okay, it is CLL which is both positive, CD5 positive and CD23 positive. All right. Mantle cell lymphoma, also remember the translocation we said is translocation 11-14. Why is the translocation 11-14? Because 14 is the IGH. What do we have basically on chromosome number 11? What overexpression do we have in mantle cell lymphoma? It is cyclin D1 overexpression. Okay, another important question. It is cyclin D1 overexpression. So how do you remember that? When the parents go mental, right? Sar jo tera chakra hai, mental matlab the sar goes round and round like a cycle. Okay. So remember, it is cyclin D1 overexpression. For the ones which are cyclin D1 negative, what is the tumor marker that we have? It is SOX11 positive. Okay, it is SOX11 positive. Okay. So remember, it is SOX11 positive. And other thing which is positive in mantle cell lymphoma, remember also there's something called as FMC7 positive. You can remember this as FMC. MC is like mantle cell. So FMC7 positive again is mantle cell. Okay, again it is mantle cell. All right. So that was about mantle cell lymphoma. Coming to the next translocation, that is translocation 14-18. Okay, where do we see translocation 14-18? Now remember this 14-year-old and 18-year-old sibling. Now this 14-year-old sibling keep following the 14-year-old sibling keeps following the 18-year-old sibling, right? So if you have been the younger sibling, I'm sure you have followed your elder sibling to all the birthday parties of their friends, and especially even if they didn't want to, but they had to take you along क्योंकि मम्मी पापा ने बोला कि लेके जाओ साथ में, right? So the 14 वाला now follows 14 follows 18, right? 14 follows 18, पीछे पड़ जाते हैं 18-year-old elder sibling के पीछे. So basically remember, these follows is follicular lymphoma. Okay, so where do you find translocation 14, 18? It is follicular lymphoma. 14 follows 18. Okay, 14 follows 18. Right. So that is what is the translocation. Tell me what CD marker is positive in follicular lymphoma? What CD marker is positive in follicular lymphoma? When you write follicular lymphoma, FO. So remember that basically it is like 1 and 0. So it is CD10 positive. Okay, it is CD10 positive. Follicular is CD10 positive. Okay, all right. So remember that follicular is CD10 positive. Okay, it is CD10 positive. Now the 50% of follicular lymphomas, they actually then progress to they transform into diffuse large B cell lymphoma. Okay, they transform into diffuse large B cell lymphoma. The difference here is follicular lymphoma is generally indolent and diffuse large B cell lymphoma is aggressive. Okay, it is aggressive. Okay. The most common non-Hodgkin's lymphoma overall is diffuse large B cell lymphoma. Okay, it is diffuse large B cell lymphoma. Okay. All right. So yes, tell me which is BCL2 positive, which is BCL6 positive. So when you write follicular, okay, remember that when you write follicular, the LL which is L2, okay, so that is BCL2 positive. Okay, it is BCL2 positive. And because follicular is from the germinal center, the marker for this is BCL6. So it is BCL6 positive. So follicular is both positive. Diffuse large B cell lymphoma is BCL6 positive but BCL6 negative. Okay. So remember follicular. Basically follicular is L2. It has double L. So it is LL coming together. It is BCL2 positive. Okay. And both of them are BCL6 positive. Follicular also and diffuse large B cell also. Okay. And how do you identify the image of follicular? In the image based question, if you get a question, as the term says follicular lymphoma, it has a follicular pattern. Okay. So you will see the follicles like this, like you see the follicles thyroid mein. So the classical image of follicular would be the follicles like this. Okay, it would have follicles like this which will be seen in the image. Okay. So that is about follicular. Remember, it has an indolent course. It has a waxing waning course. Okay, basically another important term in clinical scenario. Waxing waning course of the lymph nodes. The lymph nodes are present, then they go away, they decrease in size, then they increase, then they decrease. It has a waxing waning course. Okay. So what did we learn here? Chromosome 14 is common. 8-14 is Burkitt's. 11-14 make the parents go mental. And 14-18 basically follows. So that is follicular lymphoma. Okay, that is follicular lymphoma. 14-18 which is positive. Okay. The rest of the ones in the list that you see here, Burkitt's done, follicular done, mental done. What is positive in mild lymphoma? Anyone? What translocation do we have in the mild lymphoma? What translocation do we have in mild lymphoma? Mild lymphoma, myeltoma, basically we have read in association with H. pylori, right? So basically these are the lymphomas which are seen at the sites of chronic inflammation vagera. Okay, so this is also called as marginal zone lymphoma, the extranodal marginal zone lymphoma. Okay, now yes, it is translocation 11-18. So when you write mild, okay, when you write mild, remember AL and AT. AL is like 11 and AT is like 18. Okay, remember it is 11 and 18. So it is translocation 11-18 that we see in mild, the extranodal marginal zone lymphoma. So suppose if I ask you a question that there is a patient of Hashimoto's thyroiditis, what kind of lymphoma do we generally see in Hashimoto's? Is it mantle cell? Is it follicular? Is it Burkitt's? It is marginal zone. What kind of lymphoma do we see in Hashimoto's or in Sjogren's or with H. pylori? Is it mental, marginal, follicular, Burkitt's? What lymphoma do we see here? So remember all these inflammatory or infective lesions, basically the sites where we have inflammation or infection. Remember in inflammation, we have the margination of the WBCs, right? There is margination which occurs. So remember, it is margination like that is marginal zone lymphoma. The extranodal one which is called as MALT. Okay, the extranodal one which is basically maltoma. Okay, if I ask you the question, what is the most common extranodal site for the non-Hodgkin's lymphoma in a HIV positive patient and otherwise? What is the most common extranodal site for the lymphoma? In HIV positive patient, it is primary CNS lymphoma. Otherwise, it is GIT. And even in GIT, it is the stomach, right? जो H. pylori वाला हम पढ़ते हैं maltoma, that is the most common site. Okay, most common extranodal site. Okay. And APML is basically your M3. 3 के table में आता है 15. Remember, it is translocation 15-17. Okay, it's translocation 15-17. All right. So this is one table that I've got for you to look at the various translocations. Look at this. Burkitt's lymphoma, the genes is the MYC gene everywhere because it's chromosome number 8 everywhere. Then you have 14, 2 and 22. 2 and 22 basically is for the light chains. Okay, the kappa and the lambda. Okay, so light chains, heavy chain, basically with the MYC gene, that is Burkitt's. Mantle cell, CCND is basically your cyclin D1. Okay, translocation 11, 14. Follicular lymphoma, which also progresses to diffuse large B-cell lymphoma. Basically, you will have 14, 18, BCL2, BCL6. Okay, BCL2, BCL6 positive. MALT is 11, 18. Okay, at least remember 11, 18. Then the next that we have important one, this is important. The anaplastic large cell lymphoma involves chromosome number 2. Because basically this gene, the ALK, anaplastic large cell kinase wala jo hai, the ALK is present on chromosome number 2. So remember, ALK is basically chromosome number 2. Okay, that is what I want you to remember. The extra point here, ALK is basically chromosome 2 and it is involved in anaplastic large cell lymphoma, which is basically a T cell lymphoma. Okay, it's basically a T cell lymphoma. All right. All right. Can someone tell me where do you see CD103 positive? Where do you see CD103 positive? So write it as 1. Okay, this is 1. This is 0 and this is 3. Okay. So this is basically, this is what you see here. Okay, that is what is 1, 0 and 3. So you can see that this is basically a face which is showing the hair. So this is basically hairy cell leukemia. Okay, basically this is hairy cell leukemia. This is not mycosis. This is hairy cell leukemia 103. Okay, this is the hair. The 1 is basically the hair. So write it down like this so that you remember 103 is hairy cell leukemia. Few questions. Hairy cell leukemia is B cell or T cell? It is B cell. So when you write this ear, you make the ear here. Remember, this is B cell lymphoma, which is memory B cell. Okay, it is memory B cell. Another important question. Hairy cell leukemia involves the white pulp or the red pulp of the spleen. Remember, this is one of those rare lymphomas which involves the red pulp. So you can make this hair, when you make the hair, make it red color so that you remember it as it involves the red pulp and not the white pulp. Okay, the rest of them involve the white pulp. Another red pulp wala is hepatosplenic lymphoma. Next question. What is the most sensitive and specific marker for hairy cell leukemia? It is annexin, right? It is annexin which is positive. It is TRAP positive. Remember, TRAP is tartrate resistant acid phosphatase. It is not alkaline phosphatase? It is acid phosphatase. Very important question again. Hairy cell leukemia, it can have fried egg appearance. Okay, it can have fried egg appearance, and the presentation is an elderly patient. Splenomegaly is significant, and there is pancytopenia. There's a dry tap, splenomegaly with dry tap. That's the most common history, elderly patient. Okay, all this is hairy cell leukemia. Okay? Which one is this? We have already seen this. CD5 positive, CD23 negative. 5 positive is mental cell lymphoma. Okay, mental is translocation. 11, 14. It is the naive B cells, the naive B cells in the mental zone. Okay, that is mental cell lymphoma. You will basically see in the biopsy homogeneous cells. Okay, homogeneous cells. CD5 positive, 23 positive, both positive, combined positive. This is CLL. Okay, CLL or SLL. What is the difference between the two? CLL in the blood, SLL in the lymph node. So here the lymphocyte count is more than 5,000. Here it is less than 5,000. Okay, that's the difference between CLL and SLL. CLL, remember, chronic. So it is seen in a patient who's chronic, on the earth chronically. That means it is generally elderly patient with generalized lymphadenopathy, fatigue, all that is the history. What cells do we see in the CLL? What cells do we see in CLL? Smudge cells, right? The cells which are destroyed. So remember, chronic, elderly, which are about to be destroyed from the earth. That is the smudge cells, parachute cells, basket cells, as they are called. Right, very important question. Hemolytic anemia, autoimmune hemolytic anemia is seen with CLL. So remember all the destruction basically. Cells ka destruction, RBCs ka destruction, all this is seen with CLL. Okay. Let's try solving this question. Tell me, what do you think would be the answer to this? So 67-year-old man, increasing weakness, weight loss, hepatosplenomegaly, lymphadenopathy. There is increased lymphocytes that are destroyed during the slide preparation. That is the most important clue here. Lymphocytes are 50%. What is the clonal expansion of? What is the clonal expansion of? So CLL, basically remember it is a tumor of mature B cells, right? So basically it is a clonal expansion of B lymphocytes. CLL is your mature B cells. Okay, mature B cells. Okay? Next one, what are we seeing in this image basically? This is a cell which is getting destroyed. So basically this is the smudge cell. Okay, this is the smudge cell which is seen with CLL. Okay, this is smudge cell CLL. Okay, look at this image. You can see this follicular pattern, right? So this is how the image would be of follicular lymphoma. Okay, this is how would be the image of follicular lymphoma. Okay, very, very important. This is how follicular lymphoma would be. Translocation, 14 follows 18. CD marker, CD10 positive. LL, remember it is BCL2 positive. Okay, it is BCL2 positive. So basically this chromosome 18 is where we have BCL2, which is anti-apoptotic gene. Okay, anti-apoptotic gene. All right, can someone tell me what is this image showing here? What is this image showing here? The projections here like the hairy cell. This is hairy cell leukemia, CD103. It is a tumor of memory B cells involving the red pulp of the spleen. Annexin positive, fried egg appearance, trap positive, all that we have seen. Some important images here, 1, 2, 3 and 4. Okay, very, very important images that are frequently asked in the exam. What are we seeing here? The cell here basically that we are seeing, it has this cerebriform appearance. Okay, the nucleus has the cerebriform. From the cerebral cortex we have the seizures. Okay, so remember that is Cesari Syndrome, which is basically the blood counterpart of mycosis fungoides. So Cesari cells, cerebriform. This is the smudged cell, CLL, right, who's going to get smudged, destroyed, CLL. This is basically, you can see this white spaces. This is the starry sky appearance. Starry sky appearance is seen with Burkitt's lymphoma, right? भर के stars दिख रहे हैं sky में. Remember, भर के is Burkitt's, stars in the sky. Burkitt's is translocation 814, 28, 822. Important history in Burkitt's would be a child. It is generally common in less than 15 years of age. Burkitt's is the most common. Jaw lesion is a common history. Okay, there's gonna be a jaw lesion, which is the common history associated with EBV. Remember, Burkitt's for B, it is Epstein-Barr virus. The fourth one, right, it is the flower cell that we are seeing here basically. Right, the flower cell, the flower appearance that is seen with. Where do you see the flower appearance? ATLL, which is associated with HTLV. Okay, so ATLL basically has flower cell appearance, clover leaf or the flower appearance. Important history in ATLL, remember, it has the skin lesions and it has hypercalcemia. Okay, it has the skin lesions and it has hypercalcemia. Okay. All right. So that was about this lymphomas. This is the table from Robbins that I have included. I'll be sharing the PDF on the Telegram group. So this is the table that I've included for you to revise and note down all the important points, like we have ATLL, cutaneous lesions, hypercalcemia that we basically see with ATLL. Okay. Can you tell me the answer to this question? Which of the following will be positive for this condition? This condition you are seeing is the follicular lymphoma. 14 follows 18. So it is translocation 1418. CD marker FO is 10. It is CD10 positive. Okay, so the answer will be T. Okay, CD10 positive and translocation 1418 is what we would be seeing. All chromosomal translocations in anaplastic large cell lymphoma. Basically the ALK wala is chromosome 2. It is a T cell lymphoma. Okay, it is chromosome number 2. Okay, it is chromosome number 2 for anaplastic large cell lymphoma. Okay, so these are the points that we have basically seen, important ones in non-Hodgkin's lymphoma. Mental cell, marginal zone, which is seen in inflammatory conditions. Mental is new, hairy cell leukemia, Burkitt's lymphoma, follicular lymphoma, right? And these are the important translocation CD markers and the keywords and the images on which you'll be tested in the exam. All right. So that was a quick revision of lymphoma, the non-Hodgkin's ones. I hope all of you have enjoyed this. Please make the notes of these tricks so that you can revise them later. I'll see you again tomorrow at 12 p.m. basically for the tricks in biochemistry. The Telegram group is Dr. Nikita's Rad Synapse, t.me Dr. Nikita. We can stay connected there. I'll share the PDF there. Okay. So all the plus subscribers, see you tomorrow at 12 p.m. And again a reminder, the Unlock 20 is only till September 16. And FMG students, we are starting with the last mile batch on September 16. So make the best of the ongoing offer as well. All right. Thank you so much everyone for joining in. Goodbye. Take care and keep studying, keep revising and keep winning. Thank you.